beautiful souls. Welcome back to our channel, where we're all about helping you look and feel your best. Today, we're diving deep into a topic that affects so many of us, acne. We're going to share some tried and true methods on how to get rid of acne fast so you can regain your confidence and rock that flawless skin. If you're ready, let's jump right in. Chapter 1. Understand the basics. First things first, it's essential to understand the basics of acne. Acne occurs when hair follicles become clogged with oil and dead skin cells, leading to inflammation, pimples, and blackheads. So, to clear your skin, we need to address this issue at its roots. Pimples and acne can vary in type and severity, and their causes can be attributed to a combination of factors, including genetics, hormones, bacteria, and lifestyle choices. Here are some common types of pimples/acne and their primary causes. Number 1. Whiteheads. Whiteheads are closed comedones that appear as small, white bumps on the skin's surface. They occur when hair follicles become clogged with oil and dead skin cells. The main cause is the overproduction of sebum skin oil. Number 2. Blackheads. Blackheads are open comedones that look like small, dark spots on the skin. They develop when the hair follicles are also clogged with oil and dead skin cells, but the pore remains open. The dark color is due to the oxidation of sebum and skin cells. Number 3. Papules. Papules are small, raised, red bumps without a visible white or black center. They result from inflammation and infection of the hair follicles, typically caused by the bacteria Propionibacterium acnes. Number 4. Pustules. Pustules are similar to papules but contain pus at their tips, giving them a white or yellow appearance. They form when white blood cells respond to the infection caused by bacteria within the hair follicles. Number 5. Nodules. Nodules are large, painful, solid lumps deep within the skin. They occur when the inflammation goes deeper into the skin layers and can be quite severe. Nodules are often resistant to treatment and may lead to scarring. Number 6. Cysts. Cysts are the most severe form of acne lesion. They are large, painful, pus-filled lumps beneath the skin's surface. Cysts are caused by a combination of factors, including deep inflammation, bacterial infection, and the rupture of the hair follicle wall. Cysts often result in scarring. Number 7. Hormonal acne. Hormonal fluctuations, especially during puberty, menstruation, pregnancy, and menopause, can lead to increased sebum production and acne breakouts. Hormonal acne often appears as cysts on the lower face, jawline, and neck. Number 8. Diet. Some studies suggest that a diet high in refined carbohydrates and dairy products may contribute to acne in some individuals. However, the link between diet and acne is complex and varies among individuals. Number 9. Stress. Stress can trigger hormonal changes in the body, leading to increased sebum production and a higher likelihood of developing acne. Number 10. Cosmetics and skincare products. Certain makeup and skincare products that are comedogenic pore clogging can contribute to the development of acne. Number 11. Medications. Some medications, such as corticosteroids, lithium, and certain birth control pills, can cause or exacerbate acne as a side effect. Number 12. Genetics. A family history of acne may increase the likelihood of developing it. It's important to note that not all cases of acne are the same, and treatment options may vary depending on the type and severity of acne. Chapter 2. Establish a consistent skincare routine. A consistent skincare routine is your best friend when it comes to acne. Here are the key steps. Number 1. Cleansing. Use a gentle, sulfate-free cleanser twice daily. Number 2. Exfoliating. Incorporate a chemical exfoliant like salicylic acid or glycolic acid 2-3 times a week. Number 3. Moisturizing. Always moisturize, even if you have oily skin. Number 4. Sun protection. Wear sunscreen daily to prevent post-acne scarring. Number 5. Spot treatment. Use a targeted acne treatment with benzoyl peroxide or tea tree oil for active breakouts. Chapter 3. Diet and hydration. What you eat and drink can impact your skin. Avoid sugary, processed foods, and dairy. Instead, focus on a balanced diet rich in fruits, vegetables, and whole grains. Stay hydrated by drinking plenty of water to flush out toxins. Chapter 4. Stress management. Stress can trigger acne flares flare-ups. Try relaxation techniques like meditation, yoga, or deep breathing to keep your stress levels in check. Chapter 5. Professional help. If your acne is severe or not improving, consult a dermatologist. They can recommend prescription treatments or procedures like chemical peels and laser therapy. Chapter 6. Do's and don'ts. Finally, some do's and don'ts. Do be patient. Clearing acne takes time. Don't pick or pop pimples to prevent scarring. Do change your pillowcases regularly. Don't overuse products. Less is often more. So there you have it, our comprehensive guide on how to get rid of acne fast. Remember, everyone's skin is unique, so what works for one person may not work for another. Be patient, stay consistent, and always listen to your skin's needs. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and hit that notification bell so you never miss our skin-loving content. Thank you for watching, and until next time, stay beautiful and stay you.